Welcome to this four-part series on kidney disease. In this fourth segment, we are actually looking at the experiences with clinically supported lifestyle correction for reversing and overcoming kidney disease. To begin with, we would like to ask Dr. Jolie, what is the difference between self-lifestyle correction and clinically supported lifestyle correction?
In self-lifestyle correction, everyone will be having different ideas or different knowledge level about the ideal lifestyle or what is an optimal lifestyle. So basically, in our school or any curriculum, even in the medical studies, there is not much about the lifestyle correction or about the food and exercise and all. Generally, there will be say that everyone should do exercise and everyone should have a healthy diet. That is the basic understanding. And then there will be so many things will be circulating in the net currently, in the social media and all. So many, this is good. There will be always a trend also. So everyone will be having different ideas about it. Basically, optimal exercise and optimal nutrition means there is around 57 nutrients needed, including water and oxygen, for the human body. That is the latest understanding about the food or the nutrition, and it has certain proportions also, and that should be in the correct way. And also about the exercise, there is around 650 muscles and 250 joints in our body. All these joints and muscles should be exercised in a systematic way. Then only it is a optimal exercise. And next, third, that is the two component. The third component is minimizing the toxins going into the body. So if the three things are combined, then that is the optimal exercise. So optimal food will be different for each person. For in the way, when we look into, some may be vegan, some may be vegetarian, some may eat more of a non-veg diet. And there is so many other types of diet, like a kosher diet, halal diet, Jain diet. So different people are depending on different type of food, and also there will be so many food paths and likes and dislikes. But whatever is needed is this 57 nutrient in the correct proportion. And the exercise also we can achieve in different ways. But in many of the exercise, if you are walking or swimming, you will not be getting all the 650 muscles exercised and all. So in a clinically supported lifestyle correction, in the way I am advising to the patient or in my treatment protocol, this is the exercise which can be lie down on a bed and do it, so that it is okay for the patients also. Even everyone is patients. Not everyone is patients actually. There are people come for optimizing health or anti-aging or reducing accelerated age and all. But generally, people will be having some sickness, especially arthritis and all. They will not be able to do much of the thing. But it is actually patterned or in a specific way, which can be easily done by the patients who are having arthritis and other health problems like heart patients and everything. And also food also is formatted in that way. But that is the difference. So ideal optimal food, optimal nutrition, minimizing toxins, that is followed in a systematic way in this. And self-lifestyle correction will be different for each person actually, that we cannot comment on that. So we'll not be able to understand what is really happening. And also before this clinically supported lifestyle correction, we do a detailed study of the patient's history-wise, patient investigation-wise, and we are giving a clear understanding even about what food is optimal for them by assessing the immune system, how the immune system is reacting to different type of regular food also. So with that, we make a pattern for the individual, each person will be making an individual pattern and then asking them to follow. And also we'll be following it thoroughly on the online and also because with the special chart, and actually it is followed much better than in a hospital admission. It's not admitted in the hospital, but the patient will be followed much better, understanding their lifestyle and everything and activities and everything while they are doing the work or whatever in a home or working atmosphere itself.
Actually, what is the role of lifestyle correction in managing kidney disease?
Kidney disease, especially the chronic kidney disease, the most important, the most common cause is metabolic syndrome or metabolic diseases like diabetes, hypertension, obesity, heart disease, or atherosclerosis, which is leading into the kidney failure, or autoimmune diseases like IgA nephropathy, SLE, or many other autoimmune diseases also can affect. So, or even there are congenital or this polycystic ovarian kidney and different types are there. But whatever is this, most of them have a common reason, that is lifestyle. Even for a patient with polycystic ovarian kidney, it is, we all know that it is familial with genetic deformity. This DNA damage is there genetically. But even that case, it will be beneficial. Why? It is when there are lifestyle factors play with everything. And the expression of the genes also lifestyle factors is coming. So the epigenetic factors we can modify. Genetics we cannot modify, but epigenetics actually with the epigenetic factors which is actually driving the way to the disease. So we can modify that with the lifestyle. But there is not much of medicine in all these items. There is no medicine to cure this. So that is the. But there is, if we are addressing the problem with the correct understanding about how to correct the lifestyle, then we can solve a problem with very great extent.
Actually, when we are talking about kidney patients, normally the largest number seem to be kidney patients who have had a history of diabetes. So, can you share some examples of cases how lifestyle correction impacted kidney patients with the diabetes?
Diabetes is the most common patient generally. And most of the diabetic patients, which is having diabetes for more than 10 years, will be having their kidney function must have usually has gone. Very rarely the kidney function is already affected. So we examine if it's a diabetes patient. First thing is we'll find out whether it is a type 1 diabetes or type 2 diabetes. Many of the patients will be taking already insulin. So we'll do this insulin and the C-peptide level. C-peptide level shows that how much insulin the patient's pancreas is making. The insulin, whether the externally injected insulin, we won't be able to know. Generally, most of these patients will be, this type 2 diabetes patients will be having either a normal C-peptide and insulin level, or it will be high. So if both this will be type 2 diabetes, and we can make sure that we can, if the correct diet is given, we can stop the insulin within 24 to 48 hours, the blood sugar will be normal. So this diabetic patients and any kidney patients, the most important thing is to come out of medications. The optimal nutrition, that is actually a problem. If the this GFR is above 60, you don't have to restrict the protein and all. But if it is gone below 60 GFR, we have to you should limit the protein intake. And if the GFR is gone below 30, that is, if it is reached already stage 4, then we have to control the electrolytes, especially potassium also. So that is the difficulty. Actually, in the kidney disease, if it is if the first and second phase of renal failure, it is easy to manage for the patient and the doctor. Not much of restriction is there, and it can be generally, most of patients, it can be come to normal. So that means normal means the GFR can be brought above 90 if it is not below 60. That is in most of the cases. In diabetes patient, I have seen many patients with the GFR below 60. In the third stage also has come up to more than 90. That is the advantage actually. Diabetes patient, kidney function, the chance of recovery is much higher than compared to other cases like IgA nephropathy and all. So in diabetic patient, many patients, it's not all one or two, I have many patients, most of them will be having a low GFR, and the proteinuria will be, albuminuria will be very heavy, even 1000, 2000, that level also. In 1000, 2000 and all, albuminuria, complete reversal may not be possible, or it will take some more time. But it will reduce. The 1000, 2000 and all will come only if there is stage 5 or renal failure. Then it will be very difficult to get out of albuminuria completely and bring the GFR. If it is stage 5, already stage 5, in the late stage 5, with the creatinine 9 and 10, it will be very difficult to bring. But some amount, I recently, I can ongoing one patient, she has come with 6, 7, around 7, and she had asked for a dialysis. And within a month, her GFR creatinine has come down to 4, 7 to 4 actually, 4 point something. But even though the GI, she's still in stage 5 itself, but she's a diabetic patient and obese patient. But her recovery, she's not able to reduce the weight as we are expecting. But even though this is 7 to 4 is a very good this thing, but if she come down to 3.5 or something like that, then she will reach in the stage 4 of the renal failure. Then it will be very easy. But because she is young and she is diabetic, I hope that she will be bring down to at least stage 4 and around 3.24 creatine will be maintained. So that is the thing. From where we start, that is the most important, about how much recovery is possible. Most important thing, another important aspect is the patient will be, definitely kidney patients will be on BP medicines and cholesterol medicines, and most of them will be cardiac medicine and all. And almost all the medicines, diabetic medicines, we stop in the first day itself. So all the metformin or all the medications is over itself, kidney is relieved, and insulin also is damaging the kidney actually. So the kidney is getting relief from the medicine itself. So any medicine we consider it's a toxin. Only the nutrition is needed for our body. That is the primary thing everyone should understand. And when the patient is free of medicine, the chance of the kidney workload itself is over, and giving proper nutrition. At least if there is damaged, completely gone nephrons cannot be. The nephron is the basic unit of the kidney. Around 2 lakhs nephrons are there in a healthy kidney. Both in each kidney there is 1 lakh or 1 million, I think. I don't remember exactly, 1 million or 1 lakh. That is the difference. If your partially damaged nephrons also can be repaired. But if it is, the nephrons are too low, it is very difficult. That we should understand. When you start early, that is the most important.
Actually, you had mentioned about this diabetes and the challenges to recover from that. But at the same time, there seems to be quite some hope for many who are having diabetes and kidney disease. What is the situation with respect to those who are suffering from hypertension and who also have kidney disease?
See, hypertension is also the same. Basically, hypertension alone, if it's an IgA nephropathy, in the late stage, it is very difficult. I had seen, all the kidney patients will be having, because when the kidney start failing, that hypertension will naturally come, whatever is the reason. So basically, it is a metabolic disorder. That is diabetes, hypertension, heart disease, dyslipidemia, that is high cholesterol and atherosclerosis are common, and the patient will be having all this, and they'll be taking all these medicines. That is the most common type of patient. The most important, the beautiful thing in this clinically supported lifestyle correction that is giving me most professional satisfaction is the patient will be out of all the medications within a month. And see, the patient is free. of medicine, that they are becoming, it's not only their renal function is improving, they are becoming a non-patient, not a healthy person. So otherwise they will be continuing with the lifelong medication. So even in any stage, we can bring up the kidney function to the next level at least. And the most important, even in the fifth stage, come with creatinine 8, 9, 10. And if the patient is clinically stable, if that along with that there is cardiac failure also is there, cardiac failure. I am not saying that there is some cardiac problem, that is ejection factor, pumping is reduced, or even I'm seeing patients who are already having troponin level is high. That is already a chronic myocarditis problem is continuing. And with the creatinine and fifth stage of kidney, most of the patients with the fifth stage of kidney can have heart attack problems also, heart problem also, and even their troponin level will be high. In that patient also, we can make them out of the medications first, and then the kidney can at least most will be coming with the edema and very uncomfortable. The patient taking all these medicines will be very uncomfortable, and the patient's comfort level will be increased. So even the patients with the troponin high and all, they cannot go for a angiogram, angioplasty or bypass or anything. That also kidney patients should understand that if they are especially in the fourth or fifth stage, even on the third stage, never go for, as much as possible, for the lifestyle disease, never go for a surgery or more and more medications. They should try lifestyle correction, and they can come out, they can recover actually, or at least they can prevent the deterioration of the status. If they go for an angiogram or scanning with the contrast dye, the kidney function will be gone. I'm seeing so many patients with this contrast injection, 70 and 72 years, just going for a dyspnea, some chest discomfort, and asking for a angiogram to see whether any block. See, there is no need for checking for an angiogram for a 72 or even say above 50 years. There will be block in the heart. There's no need for anyone to do an angiogram to see how much is the percentage of block and all. But if a patient is a kidney patient also, don't go for such things. It will deteriorate the renal function. And also, if they put a stent, then they have to take this blood thinners for at least for a year. So that itself will deteriorate the renal function. So there is definitely, if the hypertensive patient, they can also come out of the thing is, they can come out of the this hypertension medicine. That is the most important, everyone should understand. But it will be easy if in the first or second stage of kidney failure. But as I said, in the diabetes patient also, if it is come down to third stage, below GFR below 60, then it will be little more difficult. And if it is below 30, more difficult, more food restriction, and below 15, it will be very difficult. But there are also many patients without any medication, even the BP can also be controlled, and no medication, then they will be free. But the thing is, they will continue with the food restriction and other restriction, mainly food restriction. It will be a problem.
Actually, in the case of this gastrointestinal disorders, often the patients will do some sort of self-medication and all that. And it is said that kidney patients sometimes actually show symptoms of gastrointestinal disorders, and there's a big connection between this. So, how does lifestyle correction impact kidney patients with such symptoms and gastrointestinal disorders?
See, gastrointestinal, most of the patients will be having gastric problems. That is very common because they are all taking medicine. This medicine is actually creating the problem, gastric problem. See, heart patients, or even without a heart patient, without any non-heart problem, the diabetic patient will be taking metformin and aspirin, at least metformin and aspirin. That is the simple medication. In everyone, it's almost anyway, more than 50% of the more than 50 years aged will be taking at least a metformin and maybe that it will be more only. I don't think it will be less. And aspirin and a statin also. So if you're taking metformin and these medicines, you will be having some gastric problem definitely. And if you have already acidity and ulcer or inflammatory bowel disease, the problem is more problematic, and it will be contributing to the renal failure also, renal problems also. So here also the same. When we look switch on to clinically supported lifestyle correction format, especially modulated food and exercise, and many will be overweight also because of the fat accumulated in the stomach itself, inside the tummy itself, will be creating problem. So when these things are usually, if the obese patients, they may reduce 2 to 4 kg in a week itself. So see the difference. In the moderately obese, at least 2 kg. So generally, people will reduce. I have seen patients reducing, especially those patients with diabetes and edema and all. They will reduce almost 4 or 5 kg first week itself after relieving this edema and also the fat. It has to go. Then only you will be comfortable. So the gastric problems will be over, and the diabetic, this other kidney problem also will be relieved. So in the clinic, this when you come to the lifestyle correction, it is not how many disease or how much medicine you are taking. It is not important. Only thing, you are correcting the body and tapering off the medication. How many medications? We see diabetes first and BP reducing 4 medicine, 3 medicine, 2 medicine. It's within 1 month, most of the medicines will be over. Only thing, if they are taking this pacemaker is already put, or the stent put within a year, then they have to continue with the blood thinners. We cannot stop if an artificial thing is put inside the blood vessels or in the heart. The blood vessel is a stent, it will be covered within a year, so you can come out of that within a year. This patient, usually that is always I tell, if your angiogram, if you're knowing about the clinically supported lifestyle correction, come before the angiogram itself, so your kidney can be protected. And if you're putting after angiogram, asking for a stent before putting the stent, because if you are coming before the putting the stent, you can avoid this blood thinners. And if you are already put the stent, you have to take that. That is also harming the kidney also, especially if in the late stage, like a 4 or 5 stage will be sad.
Actually, when we are talking about kidney disease, there seems to be an increasing number of patients with autoimmune diseases also having kidney disease. So it is considered very complicated, because this autoimmune disease and kidney, when they come together, it is difficult, it is said. How does lifestyle correction impact such patients?
If an IgA nephropathy, if it is diagnosed in an early stage, we can at least one level we can reverse, and any of this. And the most common is what we are seeing here in our part of the country, in Kerala. Basically, one is IgA nephropathy. Next is SLE. These two are the common kidney affected. And some, I have seen one patient who's having this ulcerative colitis, interstitial lung disease, and thyroiditis, and having kidney problem also. But in a moderate level, that is, I think, in the stage 3 and all. In that patient, this this autoimmune disease. And also he had hypertension, and he had put stent and so many problems, and taking so many medicines. I think 18 tablets or around 30 tablets he was taking, including for this ulcerative colitis, immunosuppressants and all. Also for the ulcerative colitis and the other thing, this interstitial lung disease, is taking everything what is possible can be given in the modern medicine, he has been given. And he was able to come out of all the medications. And I think he's in the third year or something like that. And he's following it up also. He's following everything correctly. And he's come out of all the medicines and all the lifestyle diseases, including the thyroxine, we were able to stop. It is usually the thyroid may take a little more time. Within 3 months or 6 months, he was able to come out of that also. Another thing is SLE. In SLE also, in the early stage, kidney will not be affected. I remember one patient, she's diagnosed with SLE in very, very young age, in her 20s. And now almost 15 years, she's taking medications regularly, but she came to renal failure, and she was asked for definitely this dialysis and a renal transplant. That is the only choice, no? Then this patient actually, now I think it is more than a year. She was, when she came, her creatinine was around 8 or something, but it came down to 4.5. Around 4.5 she is able to maintain, and she was obese in the initial phase, and she has come down to around 45. I asked her, she's a short lady, and I asked her to bring down to 40. She's trying for that, and she's maintained. The most important thing is SLE patient, she was taking so many medicine like HCQ and so many immunosuppressants, etc. for this symptoms for the SLE, that is immunosuppressant. Actually, that medicines created this problem. I think she was taking cyclophosphamide or something like that, which is direct, it can create kidney problems. So many of these immunosuppressants, it will suppress the immune system, but it can damage the lungs. Some of them can lead to interstitial lung disease and the kidney failure and all. So, but if a patient, that is my experience, when there are so many SLE patients are coming in. So if after years, they will, I want the patients to take up this lifestyle correction in the early stage of SLE. So you can come out of the problem fully. As the SLE patients are increasing, what every SLE patient or even any autoimmune disease patient should understand that basically the general line of management is like using immunosuppressants like steroids and other, and many may be managed to 2 or 3 or 4 immunosuppressants, and when it is not functioning, then go for biological. That is the mode of treatment, current modern medical treatment. But if they are willing for the correction of lifestyle, they can just come out of all this medication. And even the ANA test, that is actually the diagnostic test for SLE basically, even the ANA will come down. And the first thing is the patient is taking all these medicines and immunosuppressants for the symptomatic relief. And the symptomatic relief will be within weeks itself. They will find it comfortable, this edema, pain, joint pain, everything will be very fast result. Depends, only thing the patient also should be following everything correctly. Within a week itself, they'll be having a reasonable improvement, and it will gradually improve. And usually here also within a month, most of the medicine can be, especially we are most giving importance for tapering of the medication, because the kidney load will be reduced if the kidney also is affected. But if the kidney, in the early stage of SLE, there will not be kidney problem, but that stage itself, we can reverse the SLE as such.
Actually, this kidney disease may be like a wake-up call. But from what you said, this lifestyle correction approach can actually give that person his life back. Like along with the other disorders and diseases also, he can get improvement. So if you look at that, how is this lifestyle correction? What are the things that you feel are positive for a kidney disease patient?
See, kidney disease patient, when they start the lifestyle correction, when they understand about the lifestyle correction, at what stage they are understanding and going for the clinically supported. See, I said, if there is a kidney problem, I don't think they'll be able to manage by themselves. They need clinical support, and it is not, I can't say which doctor is giving which way. I can say only about how I manage. In this, they can, the only thing is which stage. If they are coming early, they can be careful in the future, and they can they lead a full life without a renal failure. But in the late stage, at least they can avoid this dialysis for a great extent. And even if they are waiting for, if it's in a very late stage, only renal transplant is possible, at least for that waiting period, they can be comfortable and make them more comfortable in a palliative. So in the stage 5, it is a palliative care. But in the even in the stage 5 also, in the early stage 5, if the patient is not having much of the other clinically stable, patient is reasonably healthy and all, then it is they can be this will make them very comfortable during the waiting period for the kidney and all. But and in that between also they will be able to avoid the dialysis. But in the patient is very sick and they are having heart problem or other organ also, kidney is failed, even the heart is almost in the failure state, then we will not be able to this clinical or lifestyle correction will not be able to do much benefit, because the nutrition you cannot give properly. The protein is needed and potassium has to may be restricted. Then how can we repair? So that is the most important. The repair, they need the nutrition and the hormones and everything. And when the kidney is failed, the renin is overacting, and so many things will be there, because kidney is an organ with endocrine function and all. So kidney, we cannot give a repair possibility will be much less if in the very late stage of the 5th stage itself, it's in the late stage with the clinical discomfort syndrome.
With this, we come to the conclusion of this 4-part series. The initial part, we were able to get an understanding about the reasons and causes behind kidney disease. In the second part, we saw what are the latest treatments available and how a lifestyle correction makes a big difference in patients with kidney disease. In the third part, we went through the complications that are associated with kidney disease and also the comorbidities and their treatment, like diabetes and hypertension and autoimmune diseases, etc., and their treatments, how those also could adversely impact the kidney disease. And we, in the fourth and final segment, we were looking at how clinically supported lifestyle correction was able to face kidney disease, not only helping to revert it or overcome it or manage it, but also simultaneously make improvements in the other health parameters also, because most of the kidney patients usually have multiple lifestyle diseases, and taking medicines is often seen as a negative for many kidney damaged patients. So how to get out of medications and return to a more meaningful and better life is what we saw in the last segment. Thank you.